Welcome to Life's Dirty Little Secrets. I'm Emma Waddington.
And I'm Chris McCurry. And today we are delighted, thrilled, privileged to be meeting with Dr. Claudia Drossel. Claudia is a professor in the psychology department at Eastern Michigan University. She has 2 PhDs, one from Temple University in experimental psychology and one from the University of Nevada, Reno, my alma mater, in clinical psychology. She is a licensed clinical psychologist and a researcher who specializes in behavior analytic approaches to case management. And her life work focuses on late life behavioral health. She's the co-editor of a edited volume, Applications of Behavior Analysis in Healthcare and Beyond, 2021. And with my wife, Sue, she wrote a book called Treating Dementia in Context, a step-by-step guide to working with individuals and families, that came out in 2011. It's hard to believe it's been 15 years since that book came out. But anyway, we're delighted to have you here. Welcome, Claudia.
Thank you very much for the introduction.
Well, aging is something that's very near and dear to my heart, more so every day. And you've done a lot of work in this area, decades worth of work. And today we're going to talk about just some aspects of aging because it's a broad topic. And one of the things that struck me about a chapter that you wrote recently was aging as an aspect of diversity. Tell us more about that. I tend not to think of aging as an aspect of diversity, but if one does think about it, it does make sense.
Right. So if you think about age, then how old we are very often determines other people's reactions to us. And in terms of social cultural determinants, these reactions really change our interactions in the world. And so the American Psychological Association has tagged age as an issue of diversity, intersecting, of course, with race, ethnicity, and other kinds of things. But think about what cohort you are. You brought up your own age, Chris. For me, it's the same kind of thing, depending on whether we're women, men, what gender we are. We might actually have very, very different encounters. Some people complain about being invisible. The American Psychological Association has lots of data that show that older adults don't really have the same healthcare access and mental health access as other adults. And so this is how it becomes an aspect of diversity, something to be trained in, because people underestimate the effect of age on our lives.
Well, I don't know when it was that people in stores started calling me sir, but sort of struck me as like, what? But here I am. No, it's really true. I mean, I've had people of late asking me, are you okay? Can you do this? Are these stairs too much? And it's like, am I an old person? But because in my own mind, I'm like 23. But on the outside, of course, I look far older.
Yeah. And that's, of course, the interesting thing that culturally, the responses to age shift so much. Becca Levy is a researcher, for example, who has found that not in all cultures do people speak about feeling younger. So like you just said, in your own mind, you're in your 20s. And then the question that we have, so from my psychological perspective, which is like a behavioral contextual perspective, is why would people bring up being younger? And what is the function of this? So what kind of purpose does it have? So if you say, like I would say, I'm in my 60s, but I'm feeling like in my 20s, well, is that an invitation, an offer to include me, to let me participate? What kind of function does it actually serve? And if it does not happen in all countries, so not in all countries do people have a distinction between their actual chronological age and their felt age. What is the difference in those cultures and in those countries? Am I expected to participate, even though I'm in my 70s and 80s, in cultures where I don't bring up my felt age or my perceived age?
So where does the U.S. fall in that continuum in terms of
we're
perceived
pretty
age?
we're pretty ageist. So yeah, we're in a youth culture where everybody wants to live longer, but nobody wants to grow old, because we associate a lot of really negative things with age. So if you think of all the stereotypes of people as they age, dotage, frailty, illness, burden, just some of the words that pop up for people when they think about older adults. And of course, these are all myths, because most older adults live very full and rich lives independently and very competently until they pass.
So as you were speaking about this idea of ageism and how we all want to, stay young and live longer as long as we stay young, what are the cultures where there isn't the ageism? Like if I think of, most European cultures, I'd say are pretty ageist.
I would say so too.
What examples do you have of cultures that are not?
I think in general, there are the cultures in which there's more reverence or respect. There's a different narrative with age. Aging is a form, of bringing wisdom, of having more experience, of being able to contribute with experience and kind of learned facts to decision making. So I think Becca Levy, for example, studied mostly also Asian cultures that might differ in reverence. And when you think about Europe, I just returned from a stay in Germany. I'm always a little bit worried about people being forced into transitions to retire, because there you might have, mandatory retirement ages, for example, which we don't have here in the United States. So even though we're such a youth culture, people are not necessarily, not in all jobs, forced into retirement. Some occupations, of course, have forced retirement. But what we're concerned about are the transitions. How do people manage, transitions from working to not working? How do parents transition from having their children at home to not having kids at home? How do you transition from being of childbearing status to not being of childbearing status anymore? And I think about this a lot because, particularly, for example, for people who have had children, it's very easy to have social contacts around children. But once you're child free, making new friendships and having different social contacts does not come automatically anymore. I think a lot of people enter new relationships related to the children that they have, children's schools, children's activities. And so when you think about aging, then aging brings about a lot of constellations of different kinds of factors that we don't necessarily anticipate when we're younger, because we get things, if you want to think about it this way, for free. So, for example, the social skills you need to have as a child-free person might be very different from the social skills you're having, as a parent, where you have this parallel engagement in different kind of activities.
Emma and I, when we were writing our first books, we were doing a little research, and we found that there were, at the time, 66,000 parenting books out there, probably way more now. I wonder how many books there are about how to be an old person. Because, I spent decades being an adolescent. I mean, I know how to do that. But, how do I do this old person thing? It's like, where's the playbook?
Well, and presumably you spent a lot of more time being an old person than you did spend being an adolescent, as most of us can count on living until well into their 90s now. And so thinking that in this culture, people typically are considered old when they're over 60, that's a third of your life being kind of spending it in the old camp. And of course, the problem with having a book on how to do this is that older adults are the most heterogeneous population. They're much more diverse, really, than younger adults, because we still have younger adults all in the same context. They go through school, So if you think of adolescents, lots of adolescents have very similar experience, but they diverge more and more. So if you're thinking of the people you went to high school with, you have diverging life paths. And as you have different experiences, you become more different from one another. And so when we as geropsychologists work with what we term older adults, so typically 60 and older, or adults in midlife and older, they're really a diverse group of people with very different histories, very different preferences, very different values. And so there is not a situation in one way does it, because it needs to be dynamic and flexible to fit lots of different and unique kind of individuals. So I think the secret, if we want to reveal a dirty little secret, is that change is kind of possible at any age, and seeing where you're at and what best fits you. You can do that in adolescence as much as you can do it when you're an older adult.
I think one exercise that would be super cool for our listeners is to bust some age myths, because we've already bust a few and this is feeling really good. Another myth that I remember reading was this idea that older adults are lonelier, are the loneliest group. And actually, the loneliest group are the younger adults. That's a
It's
big myth,
stunning.
isn't it? It is stunning, because we make this huge assumption. You have these sort of awful images of these frail old ladies living alone in their apartment. And it's the sort of images of nightmares.
Mm-hmm. It's what everybody is, yeah,
Scared
it's
of.
what people are
Yeah.
scared of. Yeah,
Yeah.
right.
Dying alone. I think that's the biggest fear.
Well, and I wonder if some of the fear of age is actually fear of disease and suffering that we tend to associate with age. But it actually turns out this is where we have the difference between correlation and causation, right? That some diseases might correlate with age, meaning as you're being exposed to all kinds of factors, as you age, you might be at higher risk. But aging does not cause any of these kinds of diseases. And so again, what people might be very scared of are really stereotypes and misassumptions about aging itself. So aging itself does not lead to disability. Disease does and can and might.
Right. So it's not actually that your body has aged, it's more that you're exposed to more experience. It's like saying as you get older, you'll experience more loss.
Yes. And right. And so in the same way that your age does not cause anybody to die, it's just correlated that you have more
Yes.
losses and people around you will pass. But as you know, loss also happens to teenagers.
Mm.
Loss happens really during any time in life. And we don't spend much time acknowledging losses in our society. As losses become more frequent, that might also then be problematic when people don't have a lot of patience. We talk about in terms of affect tolerance, but do you have patience for a person who has lost somebody and is mourning that loss, not for 3 months and not for half a year, but might actually be mourning that loss for the rest of their lives?
I was thinking the other myth about the piece around, you can live a full life up until the moment you die. I think that's invigorating to hear, because it's another big fear that people have, that, with age comes, the loss of family and friends, but also the loss of your physical strength and therefore the loss of your quality of life.
Right. And so being engaged, feeling passionate,
Mm.
seeking, looking for meaning, having intimate relationships, continuing sexual relationships, all those kinds of things we typically don't talk about and we don't associate with aging.
Yes. And those continue to matter. Yes,
Yes.
exactly. Yeah.
Yeah. And continuing to matter,
Yeah. Of
meaning
course.
you continue to matter about things. Those are the things we don't talk about. And I think what we do have kind of provider biases, because those folks who come to the attention of providers are usually the folks who have more difficulties, who might have loss that they have difficulties coping with or they don't get social support for. They might have different traumas in their histories that are continuing to affect them throughout their lives. And so, to the extent that those are the folks who come to the attention of providers, I think those are the biases that we see throughout society. I read an interesting study, and I don't know if that continues to be so, but I read that medical students, for example, who are supposed to get education about aging and ageism after gerontology rotations have been more instead of less ageist. And that might be because, again, it's this kind of selection bias in which we as providers only see people who are ill, who are frail, and it's basically providers then who also maintain the biases. That's why it's so important for providers also to get education.
But it sounds like the education that the medical students got actually pushed them in the wrong direction.
Yes, it was a little bit counterproductive. We would have to kind of look that up. I don't know how it is with your work with adolescents, whether you also find that if you are somebody who is specializing in conduct disorders, for example, has more biases about adolescents.
I was just always amazed how normal kids could be hanging out with, Ian's pals, when he was growing up compared to what I was experiencing.
That's a really interesting point. So then your exposure that you had in your life gave you enough of a different context that you could see when stereotypes emerged. And I wonder if our living in age segregated societies where you might not have grandparents or great grandparents that you're interacting with on a routine basis might actually then maintain some of these biases because you don't see the other examples that frequently.
And so many older adults are now living in these communities with just other older adults. And, some places are getting the grandkids and the multi-generational families and things, but a lot of people are just segregated. And, there's even, my mother was offended by this one aging community in her area in Southern California, where she pointed out that they had barbed wire on the top of the fences that were pointing in. So to keep the people from escaping. But yeah, if we did have a society where people were living in these mixed communities, I think that would go a long way to bust some of these myths.
Right. And I think that goes back to how do we actually structure our environments? How do we live? How are environments zoned? How walkable are there people out and about? Are there opportunities for people in different kind of cohorts and generations to meet each other? So we can actually influence a lot in terms of in what kind of environments we live.
Could you talk more about that? Because I live in Singapore, there are homes, but very few. Mostly families, you have intergenerational families, and grandparents do a lot of the childcare. Parents go to work and grandparents do the childcare. They also have sort of, if you can afford it, additional help at home. But the grandparents are very involved. And there's a lot of, they call it the filial piety, a lot of respect for your elders. And, there's lots of traditions and times during the year where you go and you give your respects to those who have passed. So actually the community here in that sense appears quite inclusive of the older adults. But as I'm listening to you, I'm thinking of the inclusion more from a workplace environment or much more cross our day as opposed to in our homes and having relationships with those in our family. Like you were saying about, the diversity piece, I find that really interesting. So I'd love to hear more about how we create these communities that are more inclusive.
Yeah, and these are really interesting problems to solve. So I, of course, as a psychologist, work with people at an individual level. And yet very often where we have to start when people come with problems is to actually look at what does their environment look like. And advocacy is then really important to make sure that people have really what we're talking about is social power and stratification in kind of public life. So are there, and I keep on thinking, are there means to engage in parallel ways? It doesn't need to be the same, but the question is, what can you contribute at different times of your life? And I think we always have to ask ourselves that. We make a lot of transitions. I'm very privileged in that I'm holding an academic position at a university and I teach, and I can choose projects that I want to be involved in. But then the question that I have to ask myself is at different stages and times in my life, what can I contribute and where is my time best spent and what matters to me most? And I think this idea of giving this choice, that is kind of what I would wish for people to be in that space where you can say, okay, this is what I can contribute now. And it's not only being based upon family, but it's being based upon how society kind of operates. And to the extent that we all live in different kind of communities, it will depend on what kind of community you're living in and what kind of role you can see for yourself, what your preferences and values are. But here the idea is really an idea that has been around in disability and rehabilitation communities for a really long time. It's always the question is, how can you live your values and what matters to you? And is there can you choose how to best do that? And why should that choice be restricted based upon age, based upon chronological number?
Yes. There's a lot of conversation here, and I know globally too, about women in their transition to menopause.
Yes, here too. Yes.
And there's a lot of conversations around making workplace more comfortable, more accessible for women as they transition. And sort of how can you, allow, depending on what the needs are, how the woman, transitions well or not well or whatever happens. But it's raising awareness that this can be a very difficult stage for many. And I don't have the stats on the top of my head, but, quite a considerable number of women choose to give up work during this time because
there's a lot of shame and embarrassment and having these kind of public hot flashes that you just can't hide.
That's right.
And so the question then becomes, if you change and you change your routines and you change the support you're getting, for example, if you're of childbearing age during a pregnancy, and you can make things work, is there a way to make things work throughout major changes, whether it's adolescence? I know, these are the folks that you're working with, whether where you have those major changes and you might need more scaffolding and support. And how do you arrange the scaffolding in such a way that it doesn't diminish your quality of life and it allows you to have equitable input? That's really the question. Yeah, and I've read those studies too. We're starting menopause work in my research lab right now because what we're interested in is what the environment and what the context looks like. So how many women and how many people who are going through menopause are having social supports? How often are things attributed to hormone changes that might actually not be due to hormone changes, but might be untenable aspects, basically, of life and demands of life. So these are all questions that I don't think we have an answer for at this time.
I mean, that's similar to something that you talk about in your chapter about age washing.
Right. And that term I adopted from a researcher at the University of Michigan. Her name is Professor Geronimus, and she wrote a book that is called Weathering and talks about how weather differently depending on structural oppression and structural factors too. So minoritized populations, for example, might be under a lot more pressure, a lot more stress, and age differently. And then what happens is that as we see these things, we might attribute them all to different patterns of aging instead of asking why. And so what kind of social determinants of health can we actually identify that might affect? And to me, this is really interesting. It's not how people age. We age all our lives, but how people live. What we really are talking about is high quality of life and maintaining quality of life throughout different kinds of transitions in life, whatever those are, whether they're, childbearing, whether they're children moving out of the house, empty nesting, losses that we have, or later on, or even early in life, diseases that we get. So we're really asking, how can we maintain quality of life and how can we not attribute things to aging? This is where age washing comes in, that are actually not part of aging, but that they're changeable. And a lot of our work when folks come in for therapy is to really try to do this kind of distinction. What is really part of age and what, so we cannot change it, and what can be changed.
I was looking at a statistic about, the amount of social contact that we have throughout our life. And it's pretty high when you're a kid, adolescence, and then it starts to drop throughout, as we get older and older and older, we actually see fewer people.
Mm-hmm.
But that doesn't mean that you're lonelier necessarily.
No, and there's also something, we know that older adults very often, so if you think about statistically, older adults are much more emotionally stable. They have a lot less depression than younger adults do. And they might be much more selective.
Yes, that's right.
As you have a different temporal perspective, if you think, well, I might have 10 more years, I might have 5 more years, you might be much more selective as to who you're spending your time with and how you're spending your time. So then what we really are talking about is also depth rather than kind of frequency. So you might have a few friends, but those friends might be very dear and intimate friends, very different from having, lots of friends or hundreds of people around you with very superficial relationships. So it's quality versus quantity.
Yes, the Harvard Adult Development Study talks about that, doesn't it? That actually that's one of the biggest predictors of happiness is the depth of your relationships versus, the quantity, but even sort of your career or your financial success. Ultimately, it's that.
Yeah. So other people, there is a Korean German philosopher. His name is Byung-Chul Han, and he wrote a book that is called The Burnout Society. So in German, it was the Müdigkeitsgesellschaft. And basically what he pointed out is that we don't have time for deep reflection anymore, but instead are consistently multitasking. So it's more like frequency of engagement than depth of engagement.
I spoke to my father, and he frequently says, you just don't need very much when you get to my age. You don't need very much. But he has a lot of clarity on what matters, and that's what he does.
That's, I think, is very important. Yeah. So this idea that values clarification occurs as
Mm,
part of life. And as you're at different points, you might ask yourself, what matters to me now? I think those are the things that we want to pay attention to, but not everybody has the privilege to stop and contemplate. And I
that's
think
right.
noticing that too,
Yes. And maybe that's
because
something
that takes
age gives
time.
you.
It does take time. Yeah, so in general, I think we underestimate the amount of satisfaction, life, passion, and power that can come with age. And I think particularly now, we're really chasing kind of topographical youth in terms of plastic surgery, in terms
Yes.
of hair
Biohacking.
color, biohacking.
Yes. Yes, that's so true. How do you explain, though, that sort of age seems to be such an important factor when it comes to the choice of presidents? And there's something about wisdom and experience that plays a part there that seems to be quite respected, and perhaps in academia too.
I think it should be more of a factor in the choice of presidents than it seems to be.
Well, age, there seems to be a sort of correlation with
Well, okay. Well,
age of late.
maybe I'm talking about maturity. Um,
Oh, here we're talking about decision making. And so I don't know, bad decisions can be made at all ages. And
Mm,
very often we believe that particularly older people might become more incompetent. That's also one of the myths and stereotypes,
yeah,
and make poor decisions. But we don't ask, has this person made poor decisions basically all of their lives?
true. Yeah.
And um, and
Just
then
doing more of the same.
and I think the worry, of course, that people have is that the onset of a lot, or the detection of a lot of the neurodegenerative diseases, correlates with age. So even though prodromal phases may be there already when a person is in their 30s and 40s, meaning they're not showing symptoms yet, but have very subtle shifts in behavior that might be interpreted as depression or anxiety. And then later on, when they hit their 60s, they might get diagnoses of things like Lewy body's disease, frontotemporal lobe degeneration has been in the news, Alzheimer's disease, those kinds of neurodegenerative diseases. And we tend to attribute those diseases to age, when age is, again, a correlation, but not causation.
If you live long enough, you can get many things.
Right. And lots of people live very long without any chronic diseases, which is kind
Mm,
of amazing when you think how many people actually make it to the end of their lives without having any of the prototypical age-related diseases. High blood pressure, high cholesterol, diabetes. So those things are true too, but we just don't talk about it. Again, we see less of those cases than we see fewer of those cases than we see the others.
yes.
well, we don't think of them as cases.
Right. But from a statistical perspective, if you counted numbers.
Right.
What does this world look like? Like what can we do? What changes can we make? I sort of certainly wish my grandparents were still alive. I think I'd learn a lot from them. And I really love this idea that we have a role at each stage, of life, and we can play a part, and that as we age, we continue to matter and about things. And what can we do in our communities to sort of start thinking about age differently?
Yeah, to me, if we think about the function of the word age, it very often just denotes the passage of time. And if you thinking about how I need to change my own behavior. So, for example, from a provider perspective, I find myself talking to somebody who's in their 90s and they're telling me about their hobbies. And I'm saying things like, oh, you're still playing tennis? And notice, right, what I'm doing. I'm showing surprise and I insert the word still as if I expected the person kind of to have stopped already, 20 years ago. So these are the biases that kind of show up. And I think what we need to see how we participate in communities that propagate stereotypes and biases. That's from birthday cards that you might buy. Think about lots of birthday cards, over the hill. You can teach an old dog new tricks,
I just got one that said you can cross dying young off your list of things to worry about.
There you go.
One of my lovely sisters. But even when you said, "Oh, you're still playing tennis," you used that tone of voice that I think you call age speaking. What is the term used for that?
Right. So there are different kinds of ways that you might show disrespect. And I love a quote by Donald Hall, who was a poet laureate. And he said basically that a lot of condescension toward the aged, toward older people, presents itself as benignity. We try to be so benevolent. And that's what you can see when people shift their voices, their intonation when they speak to older adults. They might use terms of endearment that are really not appropriate. They might use infantilizing words. So, for example, Donald Hall has a short story. It's really in his essays at 80. It's a recollection where somebody asks him, how was your din-din, for example. But those kinds of interactions are really the ones that we don't only receive when we're older, because, hopefully we will all live longer and then we become the persons that the stereotypes are being applied to. While at a younger age, we might actually kind of recklessly apply the stereotypes. And noticing when we do. So noticing when we're engaging in a different intonation, different word choice, because we're with somebody we consider older. I think getting that awareness is really, really important. And we do it automatically. I mean, ageism is one of the most pernicious forms of bias in this country. And when age washing occurs, then, meaning when we apply ageist stereotypes to ourselves, we may not seek out healthcare. I might think that my feeling tingly and weird is part of aging and not get a diagnosis of diabetes. I might not get healthcare for pain because I think arthritis is something that I just need to live with and every older person gets. And so those are the kinds of dangerous consequences of ageism in society.
And along the lines of being more selective in who you spend time with, finding a physician that is not going to just blow you off because you've got an ache here or a pain there, that somebody who's going to take you seriously and actually investigate these things and not attribute it to the fact that, okay, you're in your 70s now. My physician keeps using the phrase, well, at your age.
Right. Yeah, and having the courage, but that's also, it's not only courage, but it's also a privilege to be able to change physicians if a physician does not attend to changes that you're noticing. So I think, we can all play our part because we can change a lot, because these things are so small and ubiquitous that they're basically noticeable almost anywhere, so you can make a change. And I work with older adults and I still notice, and I'm an older adult now myself by definition, and I notice how how I have to work on my own behavior, because of course we're always members of the community, and so we reflect the biases of the community. So it's ongoing work, and we can make a lot of changes. And if you look at the Gerontological Society of America, they have a guide. It's called reframingaging.org.
We'll put that in the show notes.
Because I think, when we think about aging, like you said, it's we're aging from the minute we're born. And some of these sort of stereotypes are applied to women much, younger.
Yes. And they apply them to themselves too, much younger. And women tend to report becoming invisible. And that also happens at different ages for women. And again, here we're really talking about social practices. And to the extent that we're all engaging in them as part of society, we all can carry our part in making changes.
Final thoughts. That in and of itself was great final thought. We can all make changes.
Mm-hmm. Well, and I think this all escalates when people have a cognitive impairment. And so as people might have diseases or injuries or other events that affect their memory, attention, or decision making. If we talk about intersectionality, that disability then combined with age basically escalates and worsens all the stereotypes. And here too, and this could be a completely separate show really in talking about this, because there's a lot of change that can be made there too. So you can live with high quality of life, even when cognitive impairment is present. But it depends very much on the scaffolding and support you're getting.
That will be another podcast.
Right.
Yes, because it is true. It is true that people, when they do have, any decline, mild cognitive impairment, as, we start to talk about it, there is a lot of fear, but there is a lot of restrictions that happen and not a lot of scaffolding. And therefore life does get small.
And we really need physicians who know how to do all the rule outs and make sure that all these preventable and reversible factors are being addressed at any age, though. So this goes, across the lifespan. And I think a lot of things that we talked about today really are not particular to age, but they are really important across the lifespan. And paying attention to them across the lifespan would be a good thing generally.
Yes. As acceptance and commitment therapists, we talk a lot about, individual differences and adapting context and, how to help each individual really understand how to build your own life that's as meaningful as it can be. And that when we think about age, it's a context.
Yeah. And we need to pay attention to our relationships.
Yes.
So if some relationships might need work, because they also have shifted because of life changes and life transitions. It's not directly, again, we can engage in age washing and say with age it's different, but it might well be that life transitions make it that things need work at different times and they just need a little bit more attention and problem solving.
I do think it would be useful to have a life guide of some kind with all these skills. Like, you really can't stop learning. This idea that amongst us, you've got 2 PhDs, but we've got quite a lot of years of studying. This podcast just amongst us. We're obviously lifelong learners, but I realize that there's so much I still don't know, and how nimble we need to continue to be with these life skills as sort of life, keeps moving along and we have different experiences. I think of myself as someone that has to continue to question my assumptions and what I know about life and relationships in the world, because, things change and I need to keep moving.
I agree. I work in the field and I find that every single day I also get inspired by the people I work with.
That's right.
And I learn a lot from them. And if I said, here is a starting point, I think it's waking up, finding how we perpetuate kind of ageist practices, trying to advocate and to work against them, trying to educate ourselves all the time and seeing how we can generate more accepting and participatory and engaging kind of setting and environment for people to live their values.
So is this like the ultimate biohack at the end of the day?
Yeah, it's the biopsychosocial hack.
That's the biopsychosocial hack. Where we're looking for the answers, People are popping pills and sitting in incredibly cold ice baths and, infrared saunas. But actually, what really works to keep us living full and meaningful lives, it's community.
And noticing when we're looking for individual solutions, when the problem is actually not on an individual basis, it's on a larger social and communal basis. I think that is really important too, because particularly in our work, where a lot of people might have still a cognitive dysfunction model. They might say, oh, you have these beliefs about yourself and they're a sign of, your thinking is just off. It might well be that you're just resonating with all the biases and stereotypes within society. And the starting point is a different kind of point. The starting point is advocacy and engagement rather than trying to kind of change yourself.
Right. On that note, go forth.
Right. We have our work cut out for us. Yes.
Yeah. Oh, I mean, going back to finding something meaningful in life at any age, that could be something that people could get involved in. And we'll put some resources in the show notes for people to do that, to get engaged, to get, more information, to get inspired.
Yeah, thank you for this conversation.
Thank you, Claudia. This has been wonderful.
Thank you.
Thank you.
Really has been inspiring.